Hi everyone, I'm Dr. Soni. This is Veronica. Today we're going to be doing the under eye filler injections and we're going to be treating the tear trough region. Veronica is most concerned with the dark appearance of these tear troughs. Now there are many causes for the tear trough. They could be genetic, they could be aging. Sometimes there's even discoloration or pigmentation, which could be from either the brown discoloration or it could be from sometimes vascular leakage from the blood vessels. So her primary concern is that she has hollowing over here, and this is when fillers are able to be utilized to basically plump up that area a little bit so you're not seeing that shadow that forms that's responsible for the dark circles. This is a very quick procedure. It takes about 5 minutes, and rather than using needles, and over here I tend to use cannulas, which are kind of like needles but the tips are blunt instead of being sharp, so they tend to cause a lot less trauma to the skin, a lot less bleeding. Today we're going to be using a product called Restylane. It's regular Restylane. The reason I like using Restylane is because it doesn't attract as much water as some of the other hyaluronic acid fillers. Tends to minimize the swelling and really produces some nice results. So before we get started, the first thing we're going to do is just clean the area on both sides. This is just to disinfect the skin and try to make the procedure as sterile as possible. And again, with the cannula technique, unlike using the needles, we're not making more than one poke really. So if I want to fill this area in right over here, I'm actually just going to come from around here and I can fill this part in and this part in just from this one point of insertion. To make it a little bit more comfortable for her, I am going to give her a little bit of anesthetic, and I use a very tiny needle. It's the same size that I would use for Botox injection. Veronica, you're going to feel a little pinch. 1, 2, 3, pinch. Perfect. And it's going to burn a little bit, okay? Here we go. Doing fantastic. Another couple of seconds. And that's it. Okay, that should be the worst part. You're doing okay?
Yes.
Still with us? You're breathing?
Yes, I am.
Breathing? Don't stop breathing. So what we did was we just provided a little bit of anesthesia with a little bit of lidocaine mixed with a little bit of epinephrine. The epinephrine causes the blood vessels near that area to kind of constrict a little bit, so we minimize the bleeding. And so what I'll do now is, at the site we just gave anesthesia to, and it's very fast acting. I'm going to take a tiny needle and just make a very tiny hole at the same place, like so. And that tiny hole is my introducer hole, and through that hole I'm going to put in that cannula or that metal straw with that blunt tip, and we're going to fill everything from there. So this is my product with the cannula. The tip itself is actually blunt, it's not sharp, and that's why we made that original hole, because we're going to try to find that hole. It is rather tiny. And we're going to try to get it into the same place, and a little bit of pressure, my dear. And now we're in. You're doing fabulous. You're going to feel a little bit of pressure. And so what we're doing is we're just putting a couple of drops, not a lot. And as you can see, it's already kind of starting to lift up a little bit. And then we're going to come out just a little bit and reorient. A little bit of pressure. You're doing fabulous. It may feel a little bit weird. Deep, slow breaths. And then we're going to come on the side right here, and you can see the tip of the cannula. And just put a small amount there.
I just need some water.
Okay. You need some water?
Mm-hmm.
We just finished up this eye, and as you can see, there is hardly any swelling. I went in through this one point over here, and you can see how this area, which was a little bit sunken before, has really filled out nicely, and it just opens up her eyes, gives her certain brightness compared to this side, which you can see is a little bit flatter and it also looks a little bit darker. And the other thing I did was just enhance a little bit of the cheekbones just to give her that nice definition that extends. So now we're going to come over to her left side, and basically it's the same procedure. So Veronica, what you're going to feel initially is a pinch. 1, 2, 3, pinch. That's it, and a little bit of burning. Take a deep breath. That's the worst part. Almost done. Couple more seconds, and that's it. Good job. So it's really just that initial pinch, and the anesthetic does burn a little bit going in, but within about 5 minutes, within about 5 to 15 seconds, it actually already starts to become numb. So what we're going to do is find that area we went in, and we're going to use that. This is again our introducer needle, all we're using it for, and this is the only other poke that she's going to have, because this creates a very tiny hole, and through that again we're going to introduce the cannula through it. And again, as you can see, because our lidocaine had epinephrine in it, there's actually no bleeding. Sometimes I have to squeeze it a little bit just to see a drop of blood, so I know where to go in. Otherwise it becomes difficult for me to determine where we're going in. So again, we're going to be doing the same thing. I'm going to be going in through this tiny hole right here, and a little bit of pressure, and that's it. We're actually in, and you can actually see the tip. And again, we're just putting small amounts, just a little bit, a couple of drops. This area is not forgiving, so you definitely want to err on the side of under-correcting it than over-correcting it. And you can already kind of see it starting to come out. Maybe just a little bit more in the corner. And the inside part is done. So now we're going to do this part right here, put a little bit, and that part's done. I'm just going to come over to the other side. You're going to feel a little tugging on your face. And then we're going to go in again, and now you're going to feel a tiny bit of pressure. 1, 2, 3. Good. And now we're just kind of filling in the side of the tear trough. And that part's done. And now we're going to just give her a little bit of tiny pinch. Just enhance the cheeks just a little bit more. And we're finished. And you are done. You survived. Again, you may have a little bit of tearing. It may feel a little bit funny, but as you can see, the results are immediate. She doesn't have any bleeding, just a little bit of this pinpoint, which we can wipe away. And she is done. So we just finished the treatment. Right now, Veronica is just icing the area, as you can see. And I just want to talk a little bit about the cannula that I have here. So this is what I actually use to inject it. It may look like a needle, but it's actually not. As you can see, it's just a very thin piece of metal, but the tip itself is blunt. I would never be able to do that with a needle, and it will bend it, but it won't penetrate my skin. And that's why we use the cannula in such a delicate area as the tear trough, because it minimizes the amount of trauma that gets done. And as a matter of fact, I love this cannula so much. Most of my filling, whether it's the cheeks, temples, and sometimes even the lips and lower face and jaw region, are all done with the cannula. So Typically, my rate for bruising is maybe 1 to 2% compared to when I was using a needle, and it could be as high as 10 to 15%. So people are able to return to work pretty much right afterwards, and she's gonna heal over the next couple of days. Tomorrow she may have a little bit more swelling over here, but it usually dissipates within 48 to 72 hours. And any gel-based filler really takes about 2 weeks to fully kind of settle in and integrate. So we don't really make any decisions on whether we're gonna add more or if it's causing a problem or we're gonna take some out until at least 2 weeks have fully elapsed. So as you can see, this is a very quick, easy procedure, and in the hands of an expert, it really is quite benign. So come on in, and it will be a wonderful experience.